On a day when India reported a total of 8,813 new COVID-19 cases, Delhi is now reporting a 20% positivity rate in COVID infections. Hospitalizations are also up in Delhi as it reports a surge of coronavirus cases. In fact, Delhi's Lieutenant Governor tweeted earlier today saying we're witnessing a rise in COVID-19 infections, consistently high positivity and cases of reinfection. If we can get that graphic up on our screens, please. It is essential that we realize that the pandemic is far from over. He also appealed to all to strictly adhere to COVID-appropriate behavior. Sonakshi joining us at this point with more on that story. Sonakshi, what are we hearing?
Well, Ankita, this is extremely important and significant on a day like this when the Lieutenant Governor of Delhi tweeted out to say that we are seeing a rise in infections and COVID cases in the national capital. We also spoke to a public health expert and the member of the Lancet Commission, Dr. Sunila Garg, who told us that we are seeing a rise, an increase in the number of COVID cases in the national capital. And now we are seeing, as you can see on your television screens, in the last 24 hours, Delhi has reported over 900 cases. It is a slight dip, of course, in the number of cases, but significant to point out that in the last 12 days, consecutively for 12 days, Delhi had been reporting over 2,000 COVID cases, and now the positivity rate has reached 20%. That is, in fact, a marker for caution. We are also seeing 3 deaths being reported in the national capital. That too has seen a dip. But remember, just 3 days back on the 12th of August, we saw that there were 10 deaths reported in the national capital, which was at a 6-month high. So clearly, cases are rising in the national capital, while experts and doctors seem to suggest that this is no reason to panic, but also a marker for caution given that hospitalization has increased. Also important to point out to our viewers that it was just around the same time last year, as every year we know that the festival season has kicked in and is about to kick in right after Raksha Bandhan. So we are expecting that maybe in the days to come we will see cases rising, but experts only seem to suggest that every single person out there has to maintain COVID-appropriate behavior. But certainly a cause to a marker for caution, given that the Delhi Lieutenant Governor has put out a tweet saying that we are seeing a rise in cases in the national capital.
Sonakshi, you spoke to public health experts earlier in the day and, Dr. Sunila Garg talking about how the number of hospitalizations has gone up and also those needing ventilation. And that is clearly a worrying indicator.
Absolutely, Ankita. In fact, if I can just pull out those couple of figures that Dr. Sunila Garg pointed out, she in fact went on to say that over 500 beds at the moment in the national capital are occupied out of the 9,000 or so beds, and over 20 ICU beds are occupied out of the 2,000 beds, and over 500 oxygen beds are occupied out of the 8,000 beds. Now, again, this may not be, like I said, a cause for panic, but even Dr. Sunila Garg, a public health expert, somebody who is very well in the subject of COVID and has spoken to us through the years, through the months of COVID and pandemic, has suggested that this is a marker for caution and people are in fact being hospitalized now for COVID. We had seen a dip in that. We didn't really see in Delhi patients being admitted for COVID, but now we are seeing that that there are patients being admitted in the hospitals for COVID-related reasons. So certainly experts and doctors are suggesting that hospitalization as well is seeing an increase at a time when in the national capital cases are rising, and they are only suggesting that one has to get vaccinated, take that booster just to be on the safer side.
All right. Let's in fact play that soundbite out for our viewers.
Situation about which we need to be cautious. I will not say that it's for everybody to be panicking around. We need to be cautious about the situation and keeping the whole thing into consideration. And you mentioned there are deaths also. I'd like to add to that also that there are 65 people who are on ventilation as well.